circle of Willis. So try to understand the circle of Willis. Sir, there are our right and left two vertebral arteries. These are uniting together and making the basilar artery, and then this basilar artery is dividing, it is going back side. Sir, this is our posterior cerebral artery. Again, labeling for all of you. Sir, vertebral artery, vertebral artery. Sir, this is our what? Basilar artery. The basilar artery is dividing into two branches. What? Posterior cerebral artery, posterior cerebral artery. This is the question. Posterior cerebral artery is a branch of. Answer is the basilar artery. Pakka is the branch of what? Basilar artery. Okay. Now, sir, there is the our internal carotid artery, internal carotid artery. Agree, sir. These internal carotid artery, they are communicating with the posterior cerebral artery. What should be the name? Sir, posterior communicating artery, posterior communicating artery. Agree? Now, sir, this is the internal carotid artery. Here is the internal carotid artery. These intercarotid arteries, they are giving the branch on the front side. Sir, it is anterior cerebral artery, anterior cerebral artery. अक्का अक्का, क्योंकि आगे जा रही है इसलिए एंट्री cerebral artery होगी. एग्री बेटा? Now these anterior cerebral arteries, they are anastomosing together. Yes, this is our anterior communicating artery. Okay, sir. So now you can observe there is a one circular anastomosis is formed. Yes, circular anastomosis, anterior communicating, anterior cerebral, internal carotid, posterior communicating, and posterior cerebral artery with the same artery on the opposite side. So this circular anastomosis is known as circle of Willis. 5 component of the circle of Willis, COW. Yes, better remember, cow is very important. During the school time, essay was coming cow, गाय पर निबंध लिखो. Now you are in the medical science, but again cow is important, but this cow is circle of Willis. At time of school, one children written the essay, गाय हमारी माता है, हमको कुछ नहीं आता है. टीचर ने उस पर मार्क दिया 0 और लिख दिया, बैल तुम्हारा बाप है, नंबर देना पाप है. Okay, so remember this cow, it is very important. What is the utility of this cow? Try to understand. Suppose if there is the blockage, okay, if there is the blockage, then what will happen? Sir, the artery is not going from here, but the blood supply will go from here to the opposite side. So this is important. Okay, yes, glucose, please share your knowledge to each other. Okay, बेटा, सब लोग आपस में इन सारी चीजों को शेयर करो बेटा. Okay, so try to understand further. These are the 5 component of the circle of Willis. What are the 5 component? 5 component of circle of Willis. What are the different 5 components? So I'm going to write down for all of you. Yes, sir. First is anterior communicating artery, MCQ. Second is anterior cerebral artery. Third is internal carotid artery. Fourth is posterior communicating artery. And the fifth is posterior cerebral artery. No excuse. 5 component of the circle of Willis. Agree, beta? Now, the 5 branches of the our internal carotid artery. Sir, 5 branches of the our internal carotid artery. Look here, sir, this is our internal carotid artery. Sir, it is giving the 5 branches: anterior cerebral artery, posterior communicating artery, but also it will give very important branch. Hope you had seen in our ophthalmology class. Sir, this is the artery for the eye. Sir, this is the ophthalmic artery. No excuse बेटा, पूरा ऑप्थेल्मोलॉजी डिपार्टमेंट अगर आर्टरी सप्लाई की बात करोगे तो इस ऑप्थेल्मिक आर्टरी से चलता है. इट इज अ ब्रांच ऑफ व्हाट? इंटरनल कैरोटिड आर्टरी. Sir, it will give the branch to the supralateral surface. This is the middle cerebral artery, and it will give the branch to the our choroid plexus. So this is our, yes, anterior choroidal artery. So you will see what are the different components of the internal carotid artery. Sir, internal carotid artery, 5 branches. What are the 5 branches of the internal carotid artery? Sir, first, akka. Second, ophthalmic artery. Third, makka. Fourth, anterior choroidal artery. And the fifth is our posterior communicating artery. So magic of 5 is there. Agree? Okay. So now I'm going to ask the question. Okay. All are component of circle of Willis except akka, makka, pakka, none. Very old previous year question, na? Very old previous question abhi bhi aata hai. Which is not the component of the circle of Willis. Akka, makka, pakka, none. Which is not the component of the circle of Willis. Yes, very good, beta. Very good. You all are very nice. Makka is going outside. It is not participating in the circle of Willis. So this makka you have to remember. Next question. All are the branches of the internal carotid artery except internal carotid artery branches. Akka, makka, pakka, anterior choroidal artery. Next question. All are the branches of the internal carotid artery except internal carotid artery branches. Akka, makka, pakka, anterior choroidal artery. The posterior cerebral artery is the branch of basilar artery. Don't forget. These are the questions where we will do mistake. So remember these points. Okay. Now look here further. This vertebral artery will give one branch to the our cerebellum, that is the pica. Yes, sir. This pica is supplying the our lateral part of the medulla. Lateral medulla. So if there is a damage in the vertebral artery or damage in the pica, it will result in the lateral medullary syndrome. Yes, sir. It is the our lateral medullary syndrome, also known as the